Hello, everyone. I'm Maria Marshall. I am the director of the North Central Regional Center for Rural Development. We are pleased to have a fantastic webinar titled The Landscape of Mental Health and Financial Support for Midwest Farmers. Our speakers will be Florence Becot from Penn State, Carrie Henning-Smith from the University of Minnesota, Andrea Bjornestad from South Dakota State University, and Sarah Ruszkowski from Penn State. Thank you, ladies, for presenting this very important and relevant webinar for us. You can go to the next slide. I would like to tell you that this webinar is brought to you by the Regional Rural Development Centers. The Northeast, where Penn State is, is hosted at Penn State University. The North Central Center is hosted at Purdue University. The Southern Center is hosted at Mississippi State University, and the Western Center is at University of Idaho. So we welcome you, the Regional Rural Development Centers. Love to work together, and we thought this was a really relevant topic, particularly nowadays, with what's going on in the ag economy, to bring you this webinar and this topic that really affects farmers nationwide, not just in the Midwest. And with that, you can go to the next slide. So again, thank you for coming to this really interesting webinar. And with that, ladies, I pass on the webinar to you.
Thanks so much, Maria, and thanks so much, everyone, for joining us today. So we are excited to be talking to you about a project that our team has been working on for the last 3 years. And our year 4 of this 5-year project is actually starting today. And we happen to be all in the same room in Brookings, South Dakota, as we had an in-person meeting, and the timing of the webinar worked really well. So in terms of what we'll be talking about today, we will be talking about the landscape of mental health and financial supports for Midwest farmers. But as you'll see as we present, I think there's a lot of relevance in what we're learning to other states and regions across the country. So in terms of our team, we are an interdisciplinary project team. I am at Penn State, but of note, when we started working on this project, I was in Wisconsin. Along working with us is Andrea Bjornestad from South Dakota State, Carrie Henning-Smith at University of Minnesota, and Sarah Ruszkowski from Penn State. And we bring in different experiences and disciplines to the work in terms of rural sociology. We bring in counseling, healthcare services, access, rural economic development, and so forth. So in terms of the first question, why study the landscape of mental health and financial supports? I always ask myself, why are we doing what we're doing? What's the value in doing it? So we know that globally, agriculture is one of the occupations that experiences some of the highest stress levels. It's also one of the occupations that experiences some of the highest suicide rates. And this is something that has been documented for decades. But it's true that in recent years, in particular in late 2010s, as we were talking about the farm income crisis, and also as COVID-19 happened, there were calls for swift actions by farm organizations and policymakers, and really a lot of concerns around what can we do to support the agricultural sector as we are facing not only those mental health challenges, but there are also other challenges that the agricultural sector is facing of different magnitudes. But for example, we're looking at an aging farm population. We're asking questions around who would be producing our food in the future and under what conditions. So in terms of the response to mental health needs, there has been there was a response in terms of those challenges that we were seeing in the late 2010s. And there has been investments in resources such as suicide hotlines, counseling vouchers, and education workshops. Some of it came through the USDA Farm, Ranch, and Stress Assistance Network. You might have heard of it referred to as FARSON, and there are 4 different networks across the country. Of note, while it was funded in the 2018 Farm Bill, it was actually written in a 2008 Farm Bill already, but there hadn't been fund appropriations at the time. But that funding of FARSON was seen as a really important landmark event in terms of developing support systems for farmers. So as we have been making these investments at the federal and state levels, it's important to note that when we look at the research that has sought to understand what do mental health interventions look like for the agricultural sector, as well as their effectiveness and acceptability by farmers, the reality is the research has been pretty limited overall, and we don't have a clear sense in terms of which one, how do they work, what are the different levels of efficacies, under what conditions might they work best? And we also don't know a whole lot about what farmers think of them. And when we think in terms of extension programming, or it's important to think about how are folks interacting with these programs and are farmers seeing value in them? So in terms of what the research has looked so far, we're looking at a few different, pieces of the literature. We do know a fair amount on farmers' help-seeking strategies from previous research, both from the US and overseas. But what's important to know is a lot of that research has really been focused on the individual and what farmers do when they experience challenges. That is where we tend to talk about the stigmas that people face, that they don't want to seek help. And to some extent, to a lesser extent, some of the challenges around not having enough time to go see the doctor or not having healthcare access. But it is true that when we look at the larger environment in which farmers are making decisions around whether or not to seek help, we haven't really spent a lot of time thinking about what does healthcare access looks like in that area? What does the community look like in this area? Are people coming together when they are crises? And so that's one of the aspects that we're looking at through this project. The other thing too is that there has been attention to mental health support in agriculture to some extent, but we argue that there has been even less when it comes to financial support when farmers experience mental health challenges. And that's an important aspect to think about, because when we look at some of the key stressors in agriculture, they are connected to the economics and the finances. And so to what extent programs connected to supporting finances for farmers can bolster not only the farm business, but also their mental health and their well-being. And then the last piece that we know as well is that a lot of research on this topic either comes from the 1980s in the US and the 1990s, which was in response to the large farm crisis of the 80s. But we know that in 40 years, a lot have changed, both in terms of what rural communities look like, but also in terms of who are the farmers. The other thing to note too is that there is a fair amount of research from other countries. Australia stands out in particular because of their multi-year droughts. But the challenge is that we're looking at very different countries with different contexts in terms of what kinds of social and economic safety nets do these countries have, both for farmers as for farm business, as well as for the household. So this is where this project come in. And today we'll really focus on the landscape of support. What does it look like in the Midwest for mental health and financial challenges, as well as how do farmers engage with that landscape of support? So it is part, as I mentioned earlier, of a larger 5-year project funded by the CDC, National Institute for Occupational Safety and Health. And we are doing this work through the Upper Midwest Agricultural Safety and Health Center, which does a lot of wonderful work to support the health and safety of farmers. This is a mixed methods project, and we'll talk a bit more about it, but it also fits as part of a larger research agenda around exploring interventions that support farm families' ability to meet their social and economic needs, whether or not they are facing crisis. It's also about interrogating some of the common narratives that we sometimes have around help seeking in agriculture. So for example, and we'll talk about it later, it includes, for example, one of the common narratives that farmers do not seek help. So we'll unpack that a little bit later. We also want to make a note that this builds on previous work, and it's really important to mention that in particular, since Andrea, Carrie, and I got to meet, along with another colleague, Shoshana Inwood, 7 years ago through a project that was supported by the North Central Regional Center for Rural Development. And this project really formed the basis for this larger project. So it's important to know. In terms of our conceptual model, in line with wanting to understand what are the different factors that impact whether people are seeking help, and in turn, how that help seeking impact the outcomes. We're using the Anderson's behavioral model of health use services. And I won't go into details, but I just wanted to show you what's the underpinning model that is driving all of the work that we do, and how today, in some ways, we're going to talk to you about what are some of that larger environment looking like, and then how farmers interact with it. In terms of our study areas, we are focused on the 12 Midwest states, and we are starting, as this is a mixed method project, we started with qualitative work in South Dakota, Minnesota, and Wisconsin, and then we will expand to the 12 Midwest state later on. But we chose the Midwest. There was the practicality of the fact that at the time we were all still in the Midwest. We were all in the Midwest, and Carrie and Andrea are still here. But also from an agricultural perspective, we know that about half of US farm sales are from the Midwest. So agriculturally, the Midwest is very important. And when it comes to mental health, we also know that in the Midwest, it sees the second largest share of farmer suicide. The other piece that we really wanted to look at is the health policy environment at the state level. How are different states setting up, for example, health insurance access or healthcare access, and how is that impacting whether or not people can seek help? And we also want, so for example, Medicaid expansion is an example where at the time, South Dakota had not expanded Medicaid while Minnesota had. And then the last piece that we're looking at are variations in mental health outcomes at the county level. And what we wanted to understand is what happens when farmers live in a county that is seen as having good mental health or a low number of mentally unhealthy days. And this comes from CDC data on population level. And we wanted to understand how does that compare for farmers who live in a county where the population as a whole is categorized as being less mentally healthy. In terms of our mixed methods research design, overall, we first conducted case study profiles with 45 data points, sorry. What we wanted to understand is what does the farm sector looks like in our particular areas? How has it changed over the last 20 years? Has there been an increase in the number of farms, a decrease? How are farm sales changed? We also looked at what does the healthcare environment looks like. And we also look at what does the community structure looks like? How are people engaged socially in different groups? Have we seen a shift in what is available in terms of social and community infrastructure? Next, we conducted a document review of 93 programs and resources. And essentially, so Andrea in a minute will talk more about this, but we looked at if a farmer or someone looking to help a farmer was to go on the internet and look for help, what is there? We then interviewed 64 key informants, which have conceptualized what was happening, what are those key informants seeing. And then we've also done interviews with 53 farmers to get their perspective. And shortly, we will be doing a farmer survey. So what we'll focus on today's presentation is really that landscape aspect of things, both in terms of what is available out there, as well as what are key informants seeing in terms of what programs are available and how farmers engage with them. I'll leave it to Andrea next.
Moving on to answering our research questions. Our main research questions were, what does the landscape of support for mental health and financial challenges look like in the Midwest, as well as how do farmers engage with that landscape of support? So as far as the methods involved related to this document review, we reviewed programs and resources intended to address mental health challenges in the farm population. So these were identified at two different points in time. One was during 2019 and the other one during 2022. And we focused on the three states, Minnesota, South Dakota, and Wisconsin, looking at what farmers would see online if they were able to search for different search terms, and the terms that we used are located to the left of your screen. And then we looked at target populations around farmers, farm, and agriculture. And then looking at the document review, what types of organizations were involved, who was the target audience, the different types of programming, how were these programs delivered, as well as the focus of the programs. We also conducted 59 key informant interviews with 64 people in the fall of 2023. We looked at agricultural informants. These included our farm organization representatives. We talked to numerous university extension professionals as well as farm service providers that varied depending on what role they play within agriculture, whether it was a banker, vet, maybe an equipment dealer. We also talked to non-agricultural informants, looking at our healthcare sector with our healthcare providers, including primary and specialty care, talking to behavioral health providers, county, city officials, health agencies, and faith leaders. The counties that we targeted are located to the right of your screen. Again, we looked at 2 counties per state, and the coding of the interviews involved an interview guide and new relevant themes, as well as thematic analysis. So looking at the description of the landscape of support based on information from online searches. So looking at the online searches, the number of organizations involved, comparing the 2 points in time from 2019 to 2022, more than tripled. So back in 2019, we had 17 different organizations that were offering programming, and that increased to 62 in 2022. The types of organizations involved also shifted. Back in 2019, the main focus or the main organizations involved were actually our university extension professionals, and looking at the farm sector with other farm roles involved included farm organizations, farm service providers, state agencies, and community-based farm organizations. This shifted in 2022 to focus more on the healthcare sector. And what we saw during this time was also an increase in funding in response to COVID. And so most states received, the state departments of agriculture received funding. Farsan also increased their reach depending on what region. I know in the North Central region, more states were involved in funding during this time, which allowed possibly allowed university extension professionals to collaborate more with community-based sectors. So looking at healthcare providers, county, state health agencies, and community-based, those were the main organizations involved in 2022. The number of programs and resources also increased during this time. So looking at 2019, we had 28 different types of programs and resources that we were able to identify if farmers were to search for programs in 2019, and that increased to 93 in 2022. So this more than tripled. The populations most targeted in 2022 were the farm population. However, limited representation of the diversity farm population was definitely experienced. We noticed that most advertisements or marketing had images of white males on their pamphlets or flyers, those sorts of things that were distributed. Service providers were also targeted in more of a limited area, as far as 4.3% of program resources were targeted to them. Types of programming also shifted during this time in 2019 compared to 2022. There were more fact sheets and web pages were distributed. And here's an example from Wisconsin. Hotlines also increased during this time. Again, with that increase of funding, it allowed more of that to be established, or more funding to go into that area. So an example here is from Minnesota. Individual counseling was also highlighted. And again, here's another example. It also increased, but again, that shift that we experienced were more toward fact sheets and web pages. And finally, workshops and conferences gained an increase. And here's an example from SDSU with their Better Choices, Better Health program. So again, programming increased. However, we saw a shift in where that programming went. So an increase in absolute for all types of programming, again, highlighting the fact sheet, web pages, and hotlines. A delivery format, 54% were self-help programs and 33% were mediated help, with biggest increases between 2019 and 2022. As far as categories based on priorities identified by experts in 2019, we saw a change in education on mental health during that time, as well as a shift in improved access to care and reduce in costs. So as you can see, we had that greatest increase in shared programming to improve access to care. And some of that may have been contributed to the increase in collaborations across each of the states with the healthcare sector and being able to partner with mental health organizations as well as primary care.
Thank you for that. And I'm going to add some nuance onto what we heard about what we found in our online searches. We know that the online searches gave us a lot of information about what's available, but they didn't tell us everything that was happening at the community level. And that's why we reached out to key informants from the various sectors that we heard about earlier. We talked with key informants in the agricultural sector, in the healthcare sector, in community, local government, local public health, and also community leaders, faith leaders, and people from third places in communities. And when we talked with them, we asked them about what was available for farmers and farm families in their community to support mental health. But we also asked what was available to support financial health and the financial well-being of farmers and farm families, because we know financial stress is such an important driver of mental health concerns and stress among farmers. We talked with key informants in the 6 counties that we mentioned earlier across the 3 states. And what we found overall was that there is a lot available to support farmers and farm families, both to support their mental health and to support their financial well-being. You can see our Venn diagram of some of what we heard about here. What we heard about most often for supporting mental health was about access to care, really about formal healthcare services that provide mental health services and support groups. We also heard a lot about educational programming, the type of programming that we just heard about from our online search, things that are raising awareness around mental health issues, around stress, around providing people tools for coping. And we heard about ways to address some key stressors, getting at some of the root issues of mental health challenges and access to health insurance, which we know is a longstanding concern and challenge for farm families. For financial support, we heard most about farm-related financial support and farm business support programs, which shouldn't be a surprise given the focus of what we were doing. We heard a lot about programs to help with the viability of farm businesses, to support specific stages of the farm business cycle. But we also heard from the key informants about financial programs to support the family more broadly, and not specifically around farm issues, but around things like housing and food assistance and household and income support. Less commonly, but we still heard about this. We heard about childcare assistance and general family financial counseling, clothing drives, family leave. And we heard about financial issues related to health. Again, things related to health insurance access and design, medical, dental, vision benefits, and workers' compensation. When it came to the intersection of these two, there was quite a bit of overlap between the mental health and the financial support. And that really fell into a couple of key areas, one around addressing the financial and logistical root of mental health challenges and access to health insurance, and family leave due to changes in family structure and medical benefits, which gets at the intersection of these two areas. So we also looked to see if there were differences between people in those different sectors and who knew what about what and who was well informed about the resources that were available. Not surprisingly, this should feel like common sense. We heard that every sector knew the most about the financial programming closest to their sector. That makes sense. But we also heard that people in the health and healthcare sector they have a greater understanding of financial support programs available in the agricultural space than folks in the agricultural sector had about financial supports available in the health space. We see this as an opportunity to better connect people across sectors and to strengthen that web, that network of support and information and referrals available to farmers and farm families, so that no matter who they're going to for support and assistance, they can get the appropriate care and support that they need, and they can tap into those resources in their community. Agricultural informants mentioned financial programming for families the least. They talked to us a lot about what was happening around farm business financial support, but less about what was happening for support for the family. And I want to bring a couple of voices of those key informants into the conversation here and share a couple of quotes from them. On the top, we have a quote from someone working in the agricultural sector in South Dakota, and they said to us, "We channel resources to producers of different places, where to go, where to ask for help. We're not the experts, we're just a bridge to try to help." They were recognizing that they don't need to solve all the problems, that this is part of a network of support, and that it's important to be able to bridge that gap and help people get the resources that they need. And then from someone in the health sector in Wisconsin, we heard there's an incredible request for help with finances, and they have limited resources to do that. We have a number of food pantries. We have churches and other communities that do community meals and that are free for anybody in the community. It's just the need is so overwhelming that we can't help everybody consistently. And I think that this quote is important to bring into the conversation. While we heard an abundance of support and programs, we also heard that more needs to be done, that the available programs and supports are not on their own sufficient to meet the need of farm families.
Great, Carrie. So far we've talked about what programs are available to farmers in their area. An important piece of the study is also how farmers engage with those programs. So this section is about farmers' ability and willingness to seek help when they're facing mental health and financial challenges. So as far as their willingness and ability, key informants described farmers as most willing to seek financial help. They described the challenges, the financial challenges a lot of farmers face as being publicly visible. So farmers felt that they were in the same boat as one another and could share and reach out for help about the financial challenges. So one informant shared, "When we say we might be able to find some financial resource, literally everyone is like, yes. They're always interested in whatever we can find for them for financial help." Next, we heard from informants that farmers are really willing to seek mental health support. While we did hear about stigma still, mental health stigma still remaining, we heard a lot about it dissipating, and we heard a lot about their openness and enthusiasm to talk about mental health. Even so much so that one informant talked about planting a seed and asking how someone was doing in their stress level and hearing for about 30 minutes about how they were doing mentally. So definitely an openness and enthusiasm on some part. So one informant shared, "I think that stigma is getting better. They feel like they can seek help and be honest." On the other side of the scale here, key informants described farmers as less able to seek financial help. They talked a lot about the overwhelm in the workload and the requirements of daily operations. And so they had limited ability to research and access some of those financial support programs. One informant shared, I think the greatest challenge on a lot of farms is they're so focused on the day-to-day operations that they don't really see the functions of economics and profitability. And finally, key informants described farmers as least able to seek mental health support. So while we did see the willingness increasing over time, in many cases, informants talked about how farmers weren't able to get the mental health support that they wanted. And one informant shared, I think there's increasing openness about it in the community in general, but the challenges are just finding a provider in our local community. So what impacts farmers' help seeking? So as was mentioned at the beginning of the presentation, there's this common perception that farmers don't want to seek help. However, in these interviews, what we found was that there's really more of a tension, a tug of war between farmers' willingness and their ability to seek help that's shaping their help seeking. On the willingness side, farm viability played a big role, thinking about transitioning farmers to the next generation, keeping the farms operating was a big driver in folks' willingness. Stigma or lack thereof shaped their willingness, again, with stigma overall decreasing. Demographic characteristics, as well as existing relationships with healthcare providers. On the ability side of things, costs in terms of health insurance and healthcare, time required away from work, availability of services, as well as internet access and awareness shaped folks' ability. And these factors that are in bold are the ones that we heard most often. And so what we found is that farmers are more willing than they are able to seek help. And so what was interesting that we also found was that many of the factors that contributed to someone seeking help for mental health challenges were the same for financial challenges in terms of their willingness and ability. And the fact that the study brought both financial and mental health challenges into the mix was a really interesting way to think about how those factors impact both and for us to think about implications in the future.
We're going to highlight 4 key takeaways today, but there are many, many more that, many more implications to this research. First of all, related to availability of programs, we did find a notable increase in organizations and programs with a shift from agricultural to the healthcare center. The second finding relates to awareness of financial and mental health supports among informants, which it differed by sector. So again, that shift happened where more healthcare providers were involved in programming, as well as the different types of programming differed by sector. This was likely explained by the FAR-SAN funding as well as COVID-19 funding. Improving access to care was also a FAR-SAN priority and continues to be. And finally, people most familiar with what connects to their area of expertise is typically what is offered. Implications for service providers. Obviously, greater opportunities to collaborate between the agricultural and healthcare sectors with the hope that that will continue. But we also need to caution around medicalizing mental health challenges in agriculture. So for example, not all mental health challenges are mental illnesses. So I give the example of just because I'm sad doesn't mean that I'm depressed, or because I worry, I have anxiety. So being able to caution some of that related to mental health, our discussions on mental health. As far as decision makers, concerns connected to the sustainability of programming over time, since COVID-19 funding was only temporary, as well as will FAR-SAN funding continue? Will we see a farm bill get passed? So those are all definitely concerns moving forward.
And when we looked at who's being served by the various programs that we found in our document review and in our key informant interviews, we found that programming is largely for farmers. There's a lot of farmer-directed, farmer-centric programming, but it's likely not for all of them. And there are people who may be left out of some of the programming. We think that this is explained by a stereotype, long-standing stereotype of who really counts as a farmer. And what we didn't show you today is in the visual representation of what we found in some of the materials, there's really an emphasis on white male farmers in mental health programming. And that's true here in the regions that we looked at. It's also true in other places, other regions and other countries, or just ways that farmers are not seeing themselves represented. So in particular, women farmers are not well represented in some of the programs being offered, and they may feel as though those programs are not for them, even though we know that there's a large and growing number of female farmers. And so that's an opportunity for expanding the scope of who's represented, who sees themselves in the programs. Thinking about the implications for service providers, we're concerned that this limited representation can really potentially reinforce norms, narratives, and stigmas around who is and isn't a farmer, and also around how farmers do or don't behave or engage with some of the materials we offered. Being more expansive may make those feel more inclusive, more welcoming. And we also need to ensure that programs and resources speak directly to the diversity of needs and lived realities of farmers and farm families. For policymakers and decision makers, we would strongly caution against using a one-size-fits-all model that's not effective at reaching everyone. We need a lot of flexibility in our programs and our funding mechanisms.
So in terms of how we develop our programming, it's also thinking about how we focus on help with access instead of persuasion. So our finding is that one of our findings through the key informant interviews is that farmers are seen as more willing than they are to seek help. And one thing that we didn't have a chance to talk about the document analysis is one of the things that we noticed when we would look at programs and resources is that a lot of the writing was around convincing farmers that they needed help. But what we heard from Sarah is that we are, moving beyond some of those stigmas. And so this is likely explained by, we have seen this increase in mental health programs, a lot more discussions around mental health, in particular since COVID-19. The other thing too is that to our knowledge, we're the first study who has specifically sought to understand how willingness and ability compare. And since in the past it has been done separately, maybe that has been the case for a while, but we just hadn't looked at it that way. But in terms of our implication, what that means is that for service providers, and that connects back to what Carrie was just talking about as well, is we need to be mindful of our own biases related to farmers. When we say, oh, farmers don't like to talk, that hasn't been our experiences doing interviews for this project, but also in other aspects of our work as we work with farmers over the years, is we've seen folks willing to engage with those topics. And so we need to be mindful of that. We also need to be mindful on how our language that we use in our programs and resources could be connected to stigma and convincing. Are we by accident reinforcing stigmas that could be helpful for the population that we're looking to support? What we think is what our research reveals so far, and really connects back to other research that has been done, is the importance of helping farmers accessing programs. Maybe we have moved beyond the awareness, not to say that we shouldn't do awareness work, but there is really the importance of how do we help farmers access program. And that connects back to what Carrie was talking about, how different service providers are different awareness around what is available. And so how do we do in our mental health programming also involve information about access to financial support for the farm, but also for the household, and vice versa. When we have programming around farm business viability, how do we broach that mental health piece and point to the programs that are available for folks when they want to use them? For the decision makers, it's also the importance of addressing barriers connected to cost and availability of support. As to us, what it seems like so far in the research, it really that cost and availability comes up again and again and again, and as trumping some of the other factors that we've discussed, such as stigma and not knowing about services.
Okay, so the next finding, or the last finding we'll talk about, that is important, is that key informants, as we noted, key informants perceive farmers to be willing and open to seeking help for their financial challenges, which we think is likely explained by the connection to farm viability, farmers having a deep desire to keep the farm going and pass to the next generation. Also can be explained, we think, because those financial programs are a way for folks to address their underpinning stressors, which is in many cases what they're hoping to do. And the implications of this finding is for service providers, it reveals the importance of including financial related information to support the farm business and the farm household. Integrating both business and household has proven to be really important, as well as integrating across mental health and financial support programs. As far as decision makers, it underscores the importance of supporting diverse teams of service providers that can assist farm families. So this could be farm financial viability folks, farm transition folks, social workers, behavioral health specialists, all together on a team sort of triaging what can best assist farm families when they're in need. And last, definitely not least, it really underscores the importance of addressing those root causes of financial challenges that farmers are facing.
So there are many more implications that we could have shared today, but we didn't want to run out of time. In terms of for more information about the study, we do have information already on our website that includes the case study profiles that shows you for the 6 counties that we focused on, what does the agricultural sector looks like? What does the healthcare sector in that area looks like, as well as what does the community look like? And of note, we specifically use data that are publicly available for all counties. So this exercise is an exercise that could be done for other counties across the country if you are interested in looking at, what does the area that you work in looks like. We do have a paper published on the landscape of farmer mental health program, which is what Andrea first presented, where you see the overview of the findings as well as more implications. And we have a couple of articles in the works that we're hoping will see the day of light soon. In terms of what we do next, so we have 2 more years in the project and lots of work ahead of us, but we want to tell you some of the things that we are working on. So for example, at the moment we went back to our key informant interviews to understand what are extension educators and agricultural service providers' perspectives and experiencing supporting farmers' mental health. And one of the reasons that we're interested in looking at this is there has been in recent years increased emphasis on how do we have extension educators and ag service providers being of support to farmers that they know when they notice that there is a mental health concern. Some folks are calling them accidental counselors, and those are folks who are part of farmers' day-to-day life with whom they've developed trust over the years. And so there's been a lot of trainings developed towards that. But one question that our team has been wondering about, and I know that there are other folks asking themselves the same question because I've had the same question is, are folks prepared and willing to do it? Also, do they have the capacity to do it, as some folks have very heavy workloads already? The thing to remember is mental health challenges as well as financial challenges can be deeply personal, and the extent to which some of those accidental counselors, extension educators, agricultural service providers might not just feel like it is something that they're prepared to do. So that's something that we're looking at to understand. That came up through our interviews as well. Dig into this and look at what can we do. Are there tweaks that we should do to make sure that those folks are supported as they as they work with farmers? We also conducted our 53 farmers interviews over the winter and the spring, and we have been diving into those interviews to understand what farmers are saying in terms of their help-seeking strategies, what they see as helping them more, what they see in terms of what their community looks like, health characteristics looks like, and how that all shapes their strategies for seeking help and their outcome. And the other reason too, why we're doing this analysis is we're currently developing our farmer survey. So this is what we were doing all day yesterday together in South Dakota, was working on developing the large regional survey that we will be deploying over the winter, which is really to understand the bigger trends and patterns that are happening in the region, and also continue to dive into what variations are there. So that would be in the winter. And that's all we had for you for today. I think that we have about 15 minutes left, and we're really looking forward to having a discussion with you and answering any questions that you may have.
Great, thank you, Florence, Andrea, Carrie, and Sarah. I do see a couple of questions in the chat. I don't know if you guys want me to read them to you, or you see them yourselves. Which way?
Maria, if you have favorites, if you have some, I shouldn't say favorites because that's not fair for everyone. What are the questions that you want to hear answered, I guess?
Well, why don't I go ahead and say, there's one from Anna, says, where do you see the funding trends for services since 2022? And will they worsen with funding cuts underway now at the federal level? And she's talking about services around finances, food programs, health insurance costs, if the marketplace greatly increases premiums.
Yeah, I mean, Anna, I think it's all something that we're concerned with. We haven't, conducted another environmental scan, and it's the kind of thing that, should be done on a regular basis. And there are other colleagues around the country too that are doing something similar. I see Andy Smolsky on the phone, who has done a similar study for the South, but we are very concerned because we knew that those COVID-19 related relief packages probably played a very big role in increasing resources, in particular for the healthcare sector. There has been a lot of conversations too that have been purviewed too around what happens if some of the changes to health insurance marketplace and subsidies, if these go away. There are a lot of concerns that a lot of those programs that have been developed over the years are going to go away. And that's actually a concern that we write about in the paper that I just mentioned in the Journal of Agro-Medicine. It's that sustainability of programming. What happens, and this is not new, right? It is documented that access to mental health challenges for farmers tend to follow the ebbs and flow and crisis. And then historically, there's been this sense of, oh, the crisis is over. We don't need this anymore. We don't need these programs. And what we know is that farmer mental health challenges are not episodic, they're chronic. We also know that there will always be another crisis, we just don't know when. And so some of the challenge too is you have extensive resources that are being developed. There is excellent work going around the region and across the country. And when those resources go away, then we lose the institutional memory, we lose capacity. And so when there is another big crisis and everything needs to be rebuilt again. And so from an efficiency perspective, there are a lot of concerns. So, and I don't know if that responds to your question. I don't know if Carrie, Andrea, or Sarah have anything else to add.
That's fine. You covered it. Thank you. We just don't know.
But it is a serious concern, and it will hurt folks.
Great, thank you for that, and thanks, Anna, for your question. Let's see. There's another comment by Cassandra on she's working in a rural healthcare setting, and she's saying that affordability is a huge factor in people being able to access that program.
Thank you both.
There's another question about how farmers in the rural sector in Nigeria would be able to benefit from financial assistance.
Well, I'm afraid to say that Nigeria is not part of our study of the Midwest. However, I am looking across the table because we have the new member that joined our team semester is Akanimo is a grad student from Nigeria. So I'm sure at some point we'll expand from a geographical perspective, but we do know from the literature that financial support programs, there was a study out of Australia that was done in the early 2000s that had actually looked at support for the farm business and the farm household. As farmers were facing those major droughts, what they found was that those financial support for the household were extremely important so that people could put food on the table, pay their bills, meet their day-to-day needs. So the evidence is out there that those programs are really important. And the challenge is, one of the things that we don't talk about is, and it has come up in the interviews with the farmers, maybe more so than the key informants. So the farmer interviews are the ones that we're analyzing at the moment. It's that paperwork burden, but it's also eligibility criteria that a lot of programs are designed for folks who are employed or unemployed, but there's the assumption that they are salaried. It's really tricky, and Maria, I'm looking at you because I know it's in your area of research as well. When you're self-employed and your business assets are connected to your personal assets, it really makes it difficult to qualify for some programs. So one of the big things that the ACA, the Affordable Care Act did over the early 2010s is it changed some of those criteria around what counts as an asset so that self-employed were more able to qualify. But I think it is kind of a thing around, it's not because the programs are there that people can access them. And we've seen that too with childcare, that farmers are not able to qualify because of their business assets. So as we think about what programs are there, are people able to access them based on their reality? I think that also goes back to what Carrie was saying around, like, we have to account for those important variations that impact people.
Thank you. Yes, we do know that affordability is a big issue for those that are self-employed or have small businesses for themselves and their employees, right? And let's see. So another question from Meg is, how will you get your results and insights in front of state and federal policy and decision makers? Federal policy and decision makers.
Well, we know Meg. Well, I mean, I don't want to answer all the questions. Doing a webinar like this is important. We need to do more work around research briefs and really knock on doors. We have done, when we've done Hill visits, we have brought up that project in DC and people see a lot of importance to it. But yeah, Carrie and Andrea, what do you think? What do you want to add?
Yeah, I think a variety of dissemination efforts, direct engagement with policymakers is important. And then we're also publishing our work, some in peer-reviewed journals, because that's important for credibility. But we mentioned the case studies earlier. Those are freely available on the website. So I think materials like that, policy briefs, research briefs are important, but we also hope that all of you will carry whatever you learned from this webinar today into your various spaces and have those conversations.
And I think a lot of it directly is related to our work in South Dakota, Wisconsin, and Minnesota. So reaching out to those lawmakers are important to see if we can even make changes at the state level within these states. So in addition to obviously Washington, DC, but focusing on our state level changes could be important too.
And before we move on, I'll add a question. I'll take the privilege of adding one. So one of the key implications was this, which I think is great, is putting together people that are providing financial technical assistance with health assistance, with all of, kind of this interdisciplinary group thing. Do you have any examples of states where they're putting together somebody who might be doing farm management and thinking about financial assistance to farmers, but also thinking about behavioral and all those other things?
Yeah, I mean, we don't want to put people on the spot, but Meg, through the Department of Ag Minnesota, they have a wonderful program at the state level where they do both financial support as well as behavioral health support. Wisconsin is another one too, through the Farm Center. Their Department of Ag, DACAP, also have that dual approach. And I think it'd be interesting to talk to them too about how they approach this. And then so those are two modeled out of the State Department. There is also a great model out of New York State, out of the university, Cornell, New York Farm First, so it's a slightly different model, right? Not state agency, more like extension, and where they will do one-on-one counseling with farmers. And usually when they do their intake and working with farmers, they usually have two people, someone that's on the farm business side of thing and someone that's on the social work or behavioral health, depending on the needs. So Maria, you're right to ask that question because there are definitely wonderful models that are out there.
Great, thank you so much. Okay, Jen is asking, is there any consideration to examine the use of state credentialed peer support? Workforce shortage considerations in rural areas compounds this access resource issue.
We're looking at Andrea because that's our expert that area.
I guess I might need a little more clarification on state credentialed peer support. What might be an example?
Is Jen?
I'm from Missouri, and so we have a credentialing board that has a peer support credential. So someone with lived experience then goes through the credentialing system to get the skills that they need to be able to provide those supports in appropriate settings. The downfall to that, in my view, is that there's only certain settings that are able to get reimbursed for that service. So, but I think that has been key in my mind to be able to expand the workforce issue that we have here. And I think that's everywhere, right? But I think that's really an opportunity, but again, and I think that speaks to one of the comments about the short-term, medium, and long-term distinctions and what everyone is saying. But I think that there's a lot of work and advocacy that needs to take place in order to expand the use of those peers, but I think that's definitely an opportunity. I don't know if you guys have thought about it or if that's something that's available for you.
I think every state differs on what credentialing is happening. And so I think it's a neat idea that Missouri has implemented. And I think it's definitely an area to explore. But again, every state is at a different place related to mental health care on how they're tackling the concern. But shortages are, I mean, you look at South Dakota, every county has a mental health provider shortage. So I think every state is handling it a little differently. But thank you for bringing up the what's happening in Missouri.
Jen, if I can add, a few years ago when I was still in Wisconsin, we were looking at, with a coalition of partners in the healthcare system, we were looking at a community health workers model as an opportunity to work with farmers on mental health challenges and serve, today we've talked about farmers, and I think, that's a limitation of our work is we focus on farmers, but there's also farm workers. And whether they're domestic, whether they are, migrant farm workers or were born in the US, we know that there are a lot of struggles there. So one of the things too that we had looked to do is how can community health workers model can be used to work with different populations. One of the populations too that we were looking at was the Plain community as well.
And to kind of piggyback off a little bit, I do know that there are a lot of different states implementing peer support, farmer to farmer peer support. So not necessarily to address or work in the mental health field, but to provide that extra additional emotional support, not act as a counselor, but that peer-to-peer support, for the emotional aspects of farming. So that I'm guessing some of my colleagues on this call are probably doing that research in that area. So that's something else too. I think there can be power in not feeling alone and having that peer-to-peer support.
If you want to look into it, there's the Farmers Angels Network out of Wisconsin that is peer-to-peer as a model to look at.
Can you repeat that? I'm sorry.
Jen, it's the Farmers Angels Network. They had a very Facebook,
No.
I understand at some point.
Well, it looks like we are at the end with 1 minute to go. I want to thank our speakers for such a wonderful and relevant webinar today. We've all learned a lot, that's for sure. And look forward to going to your website and seeing more of your work come out in the next few years as you have in the project. For those of you that are still on, you will get an email with the recording and any slides that the speakers will make available if that's something that you're interested in. But again, thank you so much. This was a wonderful webinar. We really appreciate it. And I'll do a hand clap here. Thank you all for joining us, and we look forward to seeing you at our next webinar next month. Thanks.